So my name's Nicky Timmis, and I am the Public and Patient Involvement and Engagement Manager at Health Innovation Manchester. Health Innovation Manchester is often referred to as HIM, and we also host the Applied Research Collaboration. I have quite a long job title, but in short, my role is to empower colleagues to include the public and the diverse communities of Greater Manchester in our projects and programmes. So the aim of our session this morning is to provide you with a brief overview of our public and community panel, but through the voices and experiences of its members. Describe from the perspective of a public contributor what good inclusion looks like in practice, and this will be followed by an opportunity for discussion about the issues raised. For this part of the session, we'll have a live panel, which is made up of public contributors and staff. So to start our session off this morning, we've worked in partnership to create a short film about our public and community panel and members' experience of getting involved. Health Innovation Manchester and the Applied Research Collaboration works with a wide range of innovators and researchers to develop, discover and deploy new solutions that can improve the health and well-being of the 2.8 million citizens of Greater Manchester. We do this by creating partnerships with healthcare professionals and industry, large and small, that have a new product, a new service idea, or a new technology that has been shown or has the potential to bring great benefit to patients and the NHS. But working in partnership with the public and the diverse communities of Greater Manchester is crucial to this work, and so there's a great deal of emphasis on ensuring that local people are at the heart of all we do. Our substantial public and community involvement and engagement panel is an example of this, and whilst we have a long history of including the public in our work, this panel was formally launched in December 2019. So how were members recruited, and what motivated them to get involved? And what type of activities are panel members involved in? And what has been their experience of working in partnership with us? So now we're going to hear directly from some of our panel members. I'll hand you over to you, Angela.
Hello. My name is Angela Ruddock, and I'm a recent addition to the PCIE panel. Panel members have been recruited in a variety of ways, and this includes from existing involvement and engagement groups. In my case, I'm a member of the Primer Patient and Public Involvement Group. I've been a member for some 10 years and a chairperson for 3 years. I became interested in medical and clinical research following the pursuit of a personal interest, like many others I know, in a particular condition in my family, in diabetes, which is prevalent in my family, and in particular after following the progress of the treatment of 2 of my close relatives suffering from diabetes and then latterly from dementia. My role has been with researchers, to work with researchers at Manchester University and other institutions, assisting them to make their research understandable to people like me and other members of the public who do not normally have a scientific or medical background, but either because they have had direct living experience of a condition, or are carers or relatives of people who do. So this involves helping to write the researcher's study in plain English with explained medical terms and using as few acronyms as possible. I have also, as part of that work, been involved in collaborating with researchers in specific research projects. Just a couple of examples. I was involved in looking at the relationship between chest pain, depression and anxiety. And the other one, which I particularly felt was of interest to me, was looking at the influence of loneliness on the management of long-term conditions. Recently, I've been looking at a lot of stuff which involves lots of statistics and big data. I can't stress enough how much I feel I have developed in my own understanding of the dilemmas and changes that face both my colleagues as patients in the panel and also researchers who may not have had the full experience of seeing patients or carers' views of treatment, of their treatment in the world of medicine. I was particularly aware how there was little understanding by much of the research communities of the experiences of different groups within our communities. People like my mum and dad, now both passed, but whose experiences as elderly people from the Caribbean with sometimes quite negative experiences of treatment or assumptions of the treatment by health professionals. At that time, there was little or no knowledge of many of these ethnic minority communities. I also had some interesting experiences, particularly when I was pregnant, which raised concerns about my own assumptions, or assumptions that were made about me, rather, because of my ethnic background. Nicky.
Thank you for sharing that with us, Angela. We're now, so to ensure our panel could be more representative of local people and the diverse communities of Greater Manchester, there's been a focus on recruiting people from underrepresented communities and marginalised groups. But panel members are also NHS patients, and many are also living with long-term conditions, require a carer or have caring responsibilities. So we're now going to hear from John. John, would you like to introduce yourself and tell us a little bit about your background?
Yes, thanks, Nicky. Good morning, my name's John O'Doherty and I live with vascular mixed cortical subcortical dementia, heart disease, and also prostate cancer. I used to work for a local authority and I had responsibility for significant sums of money every year. If I didn't get my job right, then that would mean that people's council tax would go up. Increasingly, I found the job more and more difficult to do. I was making more and more mistakes. For example, one day I was instructed to send a cheque out to somebody, and I sent that cheque out and I dated it, and the date that I put on was actually my birthday. Had that cheque gone out, it practically bankrupted the council. Work increasingly got more and more difficult to the extent that I was demoted twice. I used to be seen as the person to go to for advice, changed to the last person to go to for advice.
And you were eventually retired, John, weren't you, on health grounds?
Yeah, following my diagnosis, yeah, I was what's called retired on ill health grounds.
You didn't have a good experience while waiting for your diagnosis either, did you, John?
No, I knew something was desperately wrong for a long time. I mean, for example, I was going to a hospital quite often for various things, and nearly every single time I used public transport, and I was getting on the wrong bus. To do that once is problematic and even amusing, But when you're doing it every single time, then there's something drastically wrong. And I went to see my GP, and I explained, not only was I having problems with my memory, but it was affecting my personality. It was affecting my entire life. And it was it was only when I was started self-harming, and I was on the verge of committing suicide, that I was sent to see a psychiatrist. And the psychiatrist did some tests, which eventually came back as being concerning. I was then sent for a brain scan, which also came back, showing cause for concern. And I was then sent to see a neurologist who gave me my diagnosis of dementia. But it was a hard, long battle.
And what has motivated you, John, to get involved in activities and panels like this?
For me, it was lack of knowledge regarding dementia, and I've also been active, in researching, in one way or the other, but. I discovered that not only was it me that was lacking knowledge, but the wider community was lacking knowledge. I mean, I'm still fairly articulate, but the assumption is in society that if you've got dementia, you shouldn't be articulate. You should just sit there, be open mouthed and unable to communicate. So that's why I got involved in research, because I also felt that I could make a difference.
And you've been involved in lots of activities, haven't you, John? Would you like to say something about the work you were doing with the University of Lancaster?
Yeah, I worked on research with the University of Lancaster, which involved visiting every hospital in the United Kingdom and making recommendations as to how this could be more dementia friendly. And significantly, 67 hospitals have adopted the recommendations made. I also sit on the Greater Manchester Health and Strategic Board, which is led by Andy Burnham, and I've done a lot of work with them, which has been recognised at senior level in Greater Manchester, which is an asset and a great boon for my enthusiasm, and helps me to get through each day and to carry on with the work I do.
You've spoken at many different and public events, haven't you? Is there a couple you'd like to mention?
Well,
such as Parliament.
Yeah, I've spoke twice at Parliament. I've spoke to the All-Party Parliamentary Group on Dementia, and I've also gave evidence to the Parliamentary Select Committee on Health and Social Care, and I'm told that I've made history in respect to that, because I'm the first person with dementia to ever have given evidence to a select committee.
It's just fantastic. Thank you for sharing that, John. We're now going to hand over to Nick.
Hello, my name's Nick Filer, and I'm a member of the Public Community Involvement and Engagement Panel, or the PCIA panel, but I've also recently been nominated as its chair. While the panel is a relatively small group made up of between 15 and 20 members, we try to represent as wide a range of different people from different backgrounds and cultures as possible. As users of health and care services through our NHS, we all have our own patient backgrounds. The health problems we have and our experiences of trying to get these conditions treated, our various interactions with doctors, nurses, dentists, etc. These experiences can be of great value. In fact, this is mostly what motivated me to look for ways to get involved. My role as panel chair is to ensure that as many different voices as possible are heard and that the panel's views can influence decision-making in relation to the wide range of projects and programs. So what do we talk about in panel meetings, and what kinds of activities are we involved in? We talk about all things health, focusing mainly on NHS research projects, but sometimes we discuss proposals that have been submitted from small businesses or large industry partners who have an innovation or idea that can improve the health and well-being of local people. Quite a lot of our discussions are not about the 80% of the patients that are well integrated into the health system, but the 20% that experience the greatest health inequalities. That's the patients that are more difficult to reach or monitor, communicate with, and treat. The types of activities we are involved in can include reviewing research proposals and making suggestions on how to communicate and engage effectively with the public, different communities, and people with additional support needs. This can involve helping to recreate documents, research ideas or findings that were originally developed for audiences such as with doctors, scientists, or professors in mind. We provide advice and guidance around the recruitment of local people with the relevant skills, knowledge, and lived experience, and how they can be supported to be involved at different stages of the project. We also highlight issues that can have some bearing or inspire future work. So what do I gain from my involvement in panels like this? I enjoy listening and considering other people's viewpoints, putting forward my own views and changing or adapting these when learning more or realizing I was wrong or biased and had not properly understood things. Getting involved in research and health projects as a patient is a great way to draw on what we have experienced day to day as patient consumers of health services. I have a background in computer science, and therefore I have long had an interest in the computerization, or what we now refer to as the digitalization, of health and social care. The digitalization of our health and care records is an example of this. This is no small change for the NHS. It's massive and is happening gradually. My involvement in the Greater Manchester Care Record project is small but important part of this programme, but I bring a public and patient perspective to a group that considers applications from researchers to use the GM Care Record data for non-clinical uses. You might ask whether this is sensible, a breach of your privacy and many other ethical questions. Well, that's one of our roles, to try and protect you and your data.
Thank you so much, Nick, for sharing. We're now going to hand over to Pat.
Hello everyone, I'm Pat Walkington and I have been working with this panel for 2 years and other similar panels and groups before this. Part of my background is in education, but I have had different jobs in the private sector. I'm passionate about inclusivity and addressing disadvantage. I'd like to talk to you about how you can get involved, either as a member of the public or a researcher. You've already heard how John, Angela and Nick became involved. I come from a small town in Wiltshire where there were few opportunities to volunteer or become involved, or maybe I was just too young to know where to look for them. When I moved to a city in the north of England as a student, I noticed that there were things that I could do to make a difference, but it was difficult to know where to start. For many people, it can be scary, just turning up on your own at a venue you have never been to and where you don't know anyone. I started running for a charity and met friends that way. Now social media can help you to find out more, and know what to expect before you make those first steps. Then only you can make the next move. I have friends who work with refugees, volunteer in dementia cafes, food banks, shelters for the homeless, and at vaccination centres. This is where you will be part of a team and gain confidence. So how did I make the move into public participation in health research? Some time ago, I joined the Public Participation Group, the PPG, at the medical centre where I am a patient. Then I signed up for Citizen Scientist in Salford, sadly no longer in existence, and looked out for health-related events and workshops where I knew that I would be comfortable. At one of these, a researcher asked me if I would like to apply to join a panel, and that was it. Since then, I haven't stopped learning, enjoying what I do, and knowing that my views and those of our panel do make a difference. You can do this too. In working with researchers on different projects, I have learned that for some of them, working for the first time with patients, the public and our panel could be a daunting experience, as sometimes researchers don't know what to expect from us. The panel has now developed a template for researchers to complete to help them plan their talks. As a diverse team, we are there to offer our views, advice, be critical friends, and give everyone involved a positive experience. This is often followed up by panel members looking at and commenting on plain English summaries, on other documents, and offering other suggestions about how a project could be improved. It is so rewarding for us when researchers feedback and let us know what changes they have put in place following meetings with us and how these have improved the work that they are doing. For example, much better responses from a survey. I'm now going to finish here as I would like to introduce a short video that Nicky and I made recently when we were asked to talk about what good public participation and involvement really means at the launch of a competition for businesses called Designed for Aging. You will learn a lot more about Nicky and me and our work from this video. So, I've taken part in all kinds of projects, some of which have worked well, where my views have been valued and I have been treated as an equal partner. Others have not been so good, where I have been the tick box bolt-on. And for those of you who know me, I'm not very good at being a tick box. Some suggestions for working with the public from my point of view are: get the recruitment right for your project. How many people do you need? Who do you need? Have you got networks that will help you to recruit? Involve end users, carers, and anyone else who's relevant, and offer support.
I totally agree, Pat. We can't stress enough how important it is to involve the right people with the relevant lived experience. But how can you find them? Well, it's important to think about who you know and the community connections that you have or that you can make to recruit people with the relevant experience.
Involve the public at the very beginning of the project, if possible, so that they feel valued and are genuine partners involved in co-design and co-production. This can be time-consuming initially, but actively listen, respond positively, be prepared to make changes, and let participants know what these are. This helps to develop trust and a multidisciplinary team where everyone learns together.
That's right, Pat. The ambition really is to try and achieve a win-win situation so that the project team can gather the meaningful insights that will inform their work, whilst ensuring that public contributors feel valued. For that to happen, you need to create a genuine partnership.
Think about the language and the design of communications. Each profession has its own jargon. This can be very confusing for the public. Use plain English, other languages, all formats in communications, and ensure that they are accessible, for example, for people with dyslexia. As panel members, we spend a lot of time rewording and redesigning communications to make them more accessible. Another thing to think about is managing expectations. Be honest about the scope of your project and what it may be possible to achieve or change. Let participants know how the project will benefit them. If equipment is involved, it needs to look good, be useful and affordable. Another tip is to get the first meeting right. You only get one chance at this. Is the venue accessible in every sense of the word? Is it friendly and suitable for a first meeting? I would advise going to a venue in the community where participants feel comfortable. Are support arrangements in place? And just remember, workplace venues can be very daunting for some people.
Yes, Pat, that's just so important. I mean, when I was working with people, adults with drug and alcohol problems in the past, I found that the most successful route to make meaningful contact was not through drug and alcohol services, as I initially thought, but through forging relationships with the voluntary sector and actually staff and service users at a local soup kitchen.
Good communication and support are key. Appoint a coordinator like Nicky with outstanding skills in working with the public, who is open-minded, accessible, sends out regular updates and manages issues. Provide support where people are unsure or anxious. This is something that Nicky does brilliantly. Participants need to feel valued. If reimbursement for travel or for people's time is involved, it needs to be a quick and easy process. Sometimes people don't have the resources to pay upfront for transport, and this can be a major problem and affect participation.
The same is true if you're asking other organisations, including the voluntary sector, to support you with recruitment. It's important that you also reimburse them, as this activity takes time. But if you can get it right, the relationship between the project team and the voluntary sector can be really mutually beneficial.
One thing that I've learned is that you need to be prepared and plan for the end of the project. Public members can often get upset or feel lost when projects end. Organise a celebration and send out regular updates on the progress of the project.
Pat and I really hope that you've found these points that we've raised useful, and both of us are going to be joining the live panel so we can be part of the discussions and answer any questions you may have.